Okay, most important among the flukes are really the schistosomes and beef flukes and the fish flukes as well. Okay, schistosoma is has got 3 different varieties of flukes. They are flukes are sort of leaf-like organisms. The schistosomes, they are sort of flat and long, narrow leaves, whereas the other flukes are more sort of oval leaves. There are 3 different genera that cause human disease: Mansoni, Hematobium, and Japonicum. Now, schistosoma, and then the other flukes are Fasciolopsis buscae, that is the okay. Then Fasciola hepatica, liver fluke. That's the normal. You must have all seen that, pictures of it, and read about it in biology. The Opistharchus sinensis, they are in the fish flukes, and canines like cats in this case, or dogs in that case, are reservoir for that. We'll talk if we get time. And then there is a lung fluke that is clinically important. I don't think we'll have time to cover them all. And I was mentioned to one of you earlier, it is believed that Napoleon's army in North America and Africa was not defeated by the enemy, but by the infestation of his soldiers with schistosomal infections. So it is prevalent, it's endemic in the northern parts of Africa. As you can see here, it's the central, southern, as well as northern part. Some part of Schistosoma mansoni is also found in South America, and then Japonicum is around that area here. Morphologically, it's a leaf-like, and they are separate, male and female, but they live attached to each other. The life cycle, humans get infected when they are bathing or swimming in water that has that is infested with these flukes. The intermediate host, the very obligate intermediate host is certain species of snails. So freshwater snails are necessary component of for maintenance of these flukes. The humans are infected by these larval forms, cysticerci, no, not cysticerci, Myrcidia, and they penetrate the skin, and from there they migrate to either in the connective tissue of the intestine or the connective tissue of bladder or blood vessels, and produce symptoms related to that. In the case of the skin, they will cause dermatitis, the inflammation of the skin, itching, is referred to as swimmer's itch. So a history of taking bathing in some freshwater reservoir in the infested areas and having itching skin is a sort of clue to schistosomal infection. And that is these symptoms are due to the toxic material that is those are components of the parasite and the skin damage. GI tract, if they go into the gastrointestinal tissue, abdominal pain, ascites, diarrhea, and bloody stool. And that is caused by the Schistosoma mansoni and Schistosoma japonicum. By contrast, Schistosoma hematobium affects the blood vessels around the bladder or bladder tissue itself. And this will result in chronic cystitis and urethritis. And it will lead to granulomatous fibrosis, the granuloma production, and that is due to a reaction to the eggs. The body reacts to the eggs, and there's inflammatory response and causes fibrosis of those tissues. And as a matter of fact, this is one of the major causes of bladder cancers in people from infested areas like Egypt and Ethiopia, Sudan, those countries. It will cause the mansoni and japonicum will cause ascites as well, inflammatory reaction to the organism. This is a picture taken from New England Journal of Medicine, where the Mediterranean or an Egyptian immigrant was suspected of bladder cancer and or had a growing mass in the bladder, and a biopsy showed this organism enlargement showing the egg. Diagnosis based on history is very important. Bathing in fresh water in an area where it is endemic. Symptoms will be, in the case of mansoni and japonicum, diarrhea and GI symptoms. And one would find eggs in the stool in the case of Schistosoma mansoni and Schistosoma japonicum, whereas one will find the eggs in the stool in the case of Schistosoma hematobium. And they have got their characteristic eggs, and I'll put all three of them so that you can compare. The Schistosoma hematobium is oval, and it has a spine here at the tip. Schistosoma mansoni has got a similar structure, oval, but has a spine here at the side. And Schistosoma japonicum egg is more roundish, not as oblong, and it may or may not have a prominent spine either at the side or at the tip. Okay, so the presence of a spine is not really a characteristic feature of Schistosoma japonicum. The way I give a tip to that hematobium has got a T in it, so it has got a spine at the tip. Schistosoma mansoni has got an S in it, and it is going to be mansoni side, and japonicum is the third one by default. Okay, and here is a true New England Journal of Medicine case. 8-year-old son of an Egyptian immigrant family is referred to the nephrology clinic with 2-year history of painless macroscopic hematuria. A smear of the centrifuge urine sample revealed this object. Right away, you've got from the history and from the symptoms and the egg shape, you can deduce it's Schistosoma hematobium. Okay, I'll just finish a couple of minutes, schistosomes, and then you can study the rest of it on your own time. The treatment is praziquantel. There was some reports that it may develop resistance to it, but then later reports showed that there is no resistance really to the drug in these organisms, at least yet. So praziquantel is still effective. Avoiding swimming into infested waters is the preventive measure, and a sanitary disposal of the sewage as well, so that it does not perpetuate itself. The elimination of the snails is a very sort of important step towards eliminating or controlling this particular infection. Snails are a common link to all flatworms, all of them. Okay? So be it schistosomes or be it the Opistharchus or the others, and there's a typical environment in which there will be a risk of acquiring schistosomal infection. Okay, I'll stop here, read the rest of it. There's not anything but very straightforward reading, and if you want to go through the PowerPoint, it is on the web. And in addition, if you have any problems or questions, email me, and I'll be happy to